Hey, this is Professor Fay with your anatomy lesson of the day. We've got the cardiovascular system built out on a model here, and so I'm going to take you through the blood flow. So first, there's a heart in here, and the heart has its own circulation called the coronary circulation. That branches off of an artery called the ascending aorta, which is the first part of the systemic circulation. So the left ventricle of the heart contracts, ejects blood through the aortic semilunar valve, and sends it up into this ascending aorta. We have right and left coronary arteries that branch off that and deliver blood to the myocardium of the heart. From there, the ascending aorta turns into the aortic arch, which is in here. It's tough to see, but it arches pretty superiorly over the heart, and it gives three vessels. So the first is the brachiocephalic trunk, which takes blood over to the right side of the body. From the brachiocephalic trunk, we'd have the right subclavian artery and the right common carotid artery. So the subclavian takes blood out to the upper extremity, and the common carotid takes blood up the neck to the face and brain. The next branch off the aorta is the left common carotid, and that would run up the side of the neck. And then it branches as the external carotid to the face, and the internal carotid, which you don't see, will go up to the brain. The next branch off the aortic arch is the left subclavian, and so you can see that right here coming out. As it comes out into the armpit area, that's the axillary artery. It runs down the arm as the brachial, and then it runs down the thumb side of the forearm as the radial artery, and down the ulnar side or pinky side of the forearm as the ulnar artery. And then you can see they kind of connect to each other in the hand here as the superficial palmar arch. There's also a deep palmar arch, and that arch has branches that go out to all of the fingers. Those are the branches off the aortic arch. From there, the aorta starts to descend through the thoracic cavity, which you can kind of see here in red. And so it descends as the thoracic aorta. It passes through a little hole in the diaphragm called the hiatus, and then it emerges into the abdominal cavity. In the abdominal cavity, there's like 5 kind of major branches off the aorta. So the first is the celiac trunk. The celiac trunk has branches that go to the liver, to the spleen, which is nestled up in there. So there's a splenic artery that branches off that celiac trunk, and then also to the stomach. Then we pass down, and you can see the right and left renal arteries. So here's a kidney, and here's a kidney, and the little red line, the little red clay that goes to them, that's the renal artery for the left side. So left renal artery, and then right renal artery going out to the kidney also. It's usually tucked behind the renal veins in blue that you can see here and here. And then we've got the superior mesenteric branch that goes out to the intestines. And then if we go down a little bit further, we've got an inferior mesenteric branch that goes out to the last part of the intestine and rectum. From there, the aorta terminates right about there and turns into common iliac arteries. There's a right and a left common iliac artery. So we've got the left one shown here. The left common iliac artery is pretty short, because then there's branches. So there's an internal iliac artery branch that goes into the pelvic cavity, and an external iliac branch that runs kind of out through the hip. It passes through the abdominal wall, which would be right about here, and emerges on the thigh as the femoral artery. There are usually some deep femoral branches that supply blood to some of the deeper thigh muscles. And then the femoral artery passes posteriorly then as the popliteal right behind the knee joint. You can see the knee right there, and then branches into the posterior tibial and the anterior tibial arteries that you can see. On the foot, we get the dorsalis pedis with branches out to the different toes. And so that's the blood flow through some of the major arteries for our human selves.